the house. Notes that mental health is a vital aspect of students' well-being and academic performance, yet it remained largely neglected. Many children in primary and secondary schools face psychological struggle, including anxiety, depression, stress, substance use, attention deficit, and hyperactivity disorder, that is ADHD. And emotional trauma, often worsened by academic pressure, bullying, family instability, and social economic difficulties. Further notes the recent UNICEF report that 1 in 6 Nigerian youths aged range from 15 to 24 often feel depressed, unmotivated, and anxiety. Many of the students' mental and emotional struggle remain undiagnosed due to lack of awareness, support system, or trained personnel. Aware that students affected by domestic issues such as abuse, neglect, separation, or trauma, leaving them unresponsive or dull in class. The students are often misjudged or isolated without support or counseling interventions. Further aware, Mr. Speaker, that current school curricula lack robust mental health education, leaving students and teachers feel acute to understand or manage emotional distress or to identify early warning signs that could prevent worsening mental health outcome. So, number 1, to commend His Excellency Engineer Oyo Assembly for his unwavering commitment to the health and well-being of the people of Oyo State, particularly the recent flag off of the enrollment of 10,000 basic school pupils in the state health insurance scheme through partnership with UNICEF and exemplary initiative that strengthen the foundation for health care future generation. Number 2, to urge the executive arm of government through the Ministry of Education, Science and Technology, State Universal Education Board, that is SUPER, and Oyo State Health Insurance Agency. So, number 1, integrate mental health education into school subjects like civil education, health education, and biology across primary and secondary school in Oyo State. Number 2, to deploy professional counselors to public schools for psycho support and to identify vulnerable students early and recommend appropriate intervention. Number 3, to utilize school-based mental health or related club and awareness program to destigmatize mental health issue to foster support. Number 4, to provide regular training for teachers and staff to recognize mental stress signs, manage classroom inclusivity, and refer students to appropriate support channel. Number 5, to ensure that students who are identified through school-based assessments and counseling units as suffering from mental health condition are captured under health insurance program to access timely affordable care. And number 6, to develop a structured, inclusive education policy that offers targeted support to students with learning and behavioral challenges. Number 3, again, to direct committee on education, basic and secondary, to interface with relevant stakeholders, including parents, teachers association, NGO, mental health experts, school management, and international bodies such as UNICEF, UNESCO, to develop an implementable framework for sustainable delivery. Mr. Speaker, we beg to move. Thank you, sir.
I also appreciate the move of this motion, the movers of this motion. It's a very timely one, and it's one that is very important that we put into place the resolutions into this as soon as possible. Mr. Speaker, the growing cases of emotional distress, substance abuse, and suicide ideation, and violence among school-age children is very rampant in our community. And it is important that we set in place systems to control situations like this. Mr. Speaker, our schools must not only be places for academic learning. People should also be able to learn and gain support mentally, emotionally, and psychologically. It is important that the mental health education will help in a big way to demystify the issues around suicide thoughts, issues around depression, anxiety, and trauma. So it's also important that we, right from our schools, and we help our students, our children, to develop mechanisms to build resilience against negative thoughts and negative and other life challenges. So based on that, I want to strongly support this motion. Second, this motion on the need to integrate mental health education, counseling services, and structured support systems in primary and secondary schools in Oyo State. Thank you very much, Mr. Speaker.
Most importantly, I believe that the counseling services is very important for students in order for them to be guided from a very early age so that the future will be clearer for them. As a matter of speaking, it's also very important that the Committee on Legislative Compliance also takes the resolution of this motion as a matter of importance. And please do a follow-up on the resolution within this motion. That being said, the motion has already been moved and seconded. Those in favor that the resolution within the motion be approved by this honorable House, say aye. Those against, say nay. The ayes have it.